Welcome to this video. This video is about passing nerve valves. It's an educational video for patients and their families. A passing nerve valve is a one-way speaking valve for patients with a trach. A passing nerve valve redirects airflow through the vocal folds, mouth, and nose, enabling voice and improved communication. The passing nerve valve is a no-leak system, which means that the passing nerve valve remains closed unless the patient inhales. The closed system allows the patient to restore positive air pressure, which stimulates a more normal respiratory system. Candidates for a passing nerve valve include patients who have had a tracheostomy in the past. They can be ventilator or non-ventilator dependent. Passing nerve valves work for adult, pediatric, or neonatal patients who are awake and responsive. Patients who have needed passing nerve valves in the past include ventilator-dependent patients, neuromuscular disease patients, patients who have quadriplegia, who have brain injury, who have chronic obstructive pulmonary disease, who have tracheomalacia, who have mild tracheal and or laryngeal stenosis, have bilateral vocal cord paralysis without significant airway obstruction, have non-obstructive laryngeal tumors, have sleep apnea, or patients who are emotionally or physically unable to tolerate tracheal plugging. Patients who are not candidates for the passing nerve valve include patients who need cuff inflation, patients who have a foam cuff, patients with thick secretions, patients who have had a total laryngectomy, or patients with a laryngeal mass or stenosis. The primary pro of passing nerve valve placement is that it reestablishes verbal communication. Verbal communication is reestablished by using the no-leak design of the passing nerve valve. Because the more closed respiratory system that it creates, positive air pressure is restored. This promotes a louder, improved voice, improved swallow, stronger cough, and increased oxygenation. Patients also produce a clearer voice with more normal phrasing, better vocal quality, and increased volume because of all the exhaled air is redirected up through the vocal folds. Other pros of the passing nerve valve include improvement in psychosocial measures, improvement in speech and language development in infants, improved swallowing. Again, because of the no-leak design of the passing nerve valves, the patient has a more normal physiology. This design allows pharyngeal and laryngeal sensation to be restored and also restores subglottic air pressure, which improves swallow and may reduce aspiration. Secretion management also improves. Patients who wear a passing nerve valve have reduced secretions and may be able to expel their secretions more easily. There's also allows for patients to have increase in olfaction or smelling, as well as vent weaning or decannulation of the trach at a faster time. There are many different types of passing nerve valves. The one on the screen is the most common type of passing nerve valve and is the PMV 005. It is the original passing nerve valve and is commonly used in non-ventilator dependent patients. This passing nerve valve is the PMV 2000. It is clear, lightweight, and opens with even less resistance than the original passing nerve valve, which was shown previously. Because of its clear design, it offers lower profile and less visibility for more ambulatory patients. This purple passing nerve valve is the PMV 2001. It is identical to the PMV 2000, except for its color. This aqua-colored passing nerve valve is the PMV 007. It is designed to fit inside most adult disposable ventilator tubing. This passing nerve valve is the PMV 2020. It is the only lightweight, one-way, closed position, no-leak valve that attaches to the Jackson metal trach. Placing a passing nerve valve is very simple. First, suction the tracheostomy tube as needed before placing the valve. It may not be possible to use the valve if the patient has a lot of secretions or very thick secretions. Second, if the tracheostomy tube has a cuff, you need to deflate it or remove the air from it before placing the passing mirror valve. Before deflating the cuff, suction the patient's mouth and nose is needed so that the secretions do not trickle into their windpipe and bronchi. Third, attach the valve to the top of the tracheostomy tube with a twisting motion to the right, or clockwise, approximately 1/4 of a turn. This will prevent the passing mirror valve from popping off when the patient coughs. In order to remove the valve, twist off to the left or counterclockwise. To take care of the passing mirror valve, you should clean it daily with mild soapy water. Rinse it thoroughly with cool to warm water. You do not want to use hot water as it may damage the valve. Make sure you let the valve dry completely using air before using it again. Never use a brush, vinegar, peroxide, bleach, or alcohol on the valve. Replace the valve when it becomes sticky, noisy, or vibrates. Safety precautions for the passing mirror valve include not wearing the valve while sleeping. The valve should only be used under direct supervision of caregivers who know how to work the passing mirror valve and how to use it correctly. Always remove the valve immediately if the patient has difficulty breathing, and suction and/or change the tracheostomy tube if needed. The valve must not be used on trachs that have a cuff inflated. That is the most important part. Thank you for watching this video about passing mirror valves. If you have any questions regarding your trach or your passing mirror valve, do not hesitate to call your healthcare provider.